Hello, and how are you? Welcome to my session on the Kenya National School Health Policy Part 2. If you've not watched this, we are starting it in three parts. The first part we catered for the introduction part, and in this second part, we are going to focus on the thematic areas that the Kenya National School Health Policy looks into. And if you're new into this channel, this is our YouTube channel that focuses on lectures, knowledge, and expert interviews related to healthcare. And if this is your area of interest, remember to subscribe, give us a share, and also comment if the video meets your interest or it's something that you'll wish to come back into. So let's dwell in and see what are these themes that you're mentioning. So the Kenya National Policy focused on these particular 8 areas, and we will dwell on them one by one. And for now, I'll just read them through. So the first thematic area is on values and life skills, followed by gender growth and development, focusing more on gender mainstreaming, the child rights and responsibilities, water, sanitation, and hygiene. Number 5 is on nutrition. 6, disease prevention and control. 7, special needs, disability, and rehabilitation. 8 is on school infrastructure and environmental safety. So as we go through these thematic areas, you will see the various strategies and how the government through the national committee was planning to ensure that each and every theme is adequately implemented in the various schools. The first theme on value and life skill, we shall begin by defining it first. So values, these are beliefs, principles, or ideas that are worthy to individuals and also their communities. And most of the time, values are inculcated to the learners with the aim of protecting them from harmful activities. So the main reason of values in our setups is to protect the children from any harmful activities. And how do we instill values? Most of the time, we instill these principles and ideas through life skills. So, with life skills, these are therefore abilities and strategies with the aim of adaptive and positive behavior that will enable an individual to deal effectively with the demands and challenges of everyday life. So the values, that is the principles of what they believe in, and then we have the life skill, which brings in now the abilities and the strategies that are quite adaptive to the behavior that will actually help the individual to effectively deal with everyday challenges. So with the life skill aspect, this is the area where now we help the learner to have good, healthy behaviors, develop and strengthen their interpersonal and psychosocial capabilities. We are working around with the children to ensure that they understand more than what they already believe in by instilling the skills, instilling the knowledge, and instilling the understanding of different capabilities and skills regarding health. So I want us to note that regarding health. For instance, in schools, children are taught how to do toothbrushing, hand washing, cleaning, and grooming. These are life skills. But then there are values and principles like honesty, being timekeepers, being able to actually practice teamwork. These are values and principles. And when you blend these two, then you're able to bring out a holistic child who can dwell in a society that is thrown in with different challenges and the child can overcome. And the second theme is the gender growth and development. So gender issues are known to either have positive or negative impact on the health and education of boys and girls. It therefore means that we need to be very gender transformative when it comes to the approaches we take in handling our children's growth and development in schools, because gender issues are society constructed, and most of these things are influenced on the child such that they carry this together into the school environmental setup. And acknowledging that the boys and girls have different biological makeup, it's therefore important that we understand we shall need different health interventions for their various needs. And the gender and growth and development theme in the policy literally was focusing more on issues surrounding cases like gender-based violence, harmful cultural practices such as female genital mutilation, child marriage, adolescence and its peer pressure, sexual transmitted infections. All these are factors that come along with gender growth and development. And so therefore the policy wanted to look into how can we protect children from such acts? How do we protect the child from GBV? How do we protect the child from harmful cultures? How do we keep this child free from influence of adolescence and infections? And for this purpose, we are told we need to now be gender transformative and ensure that we acknowledge the differences in biological markups. We need to be careful because for a girl, by adolescence, they're having menstrual periods. For a boy, when they're hitting adolescence, they're having the physical changes that come with so much effect on their self-esteem. And now when you're handling these challenges, we therefore need to appreciate that gender growth and development are intertwined and they have different effects on the children. Now, as a result, there could be a negative effect on the health and it can have a negative effect in education. Because if a child is having menstrual health and they are having menstruation at that particular time and there's no one to explain that to the girl, then some of them develops low self-esteem and this calcates into now poor grades or poor performance even in the class setup. So part of the government strategies to ensure that the area of gender growth and development is adequately catered for was to address gender-related barriers to health and well-being of the learners. And looking at the gender-related barriers could be culture that hinders the participation of girls in school or culture that hinders the participation of boys in different environments. The other bit is to promote gender equality among the learners, provide equal opportunity for both boys and girls to go to school. And then we have enhancing safeguarding against gender-based violence among learners, check on issues like child abuse, child neglect, and so on. And then safeguard and protect learners from harmful cultural practices like early marriage, FGM, femicide. All these are possible events that can happen for the children. And then the other bit is to equip learners with age-appropriate sexual reproductive health information. Looking at the development stages of these children can come up with materials and flyers that the children can read or be taught in class as part of the curriculum regarding reproductive health knowledge. Now, you need to note that depending on the age of the child, then you can introduce different age appropriate. It does not mean because the curriculum allows that particular topic to be taught, then you go into full swing and empty the whole information in the child. Remember, this is still a child. Some of them are still teenagers and they may not adequately comprehend or understand how to filter some of the sensitive information. And the other bit is to provide psychological counseling, screening, and other health related services to learners. Issues like STIs, these are areas where you can do HIV and testing and counseling. You can offer counseling services for children maybe who are suffering from issues like drug abuse and addiction. And the last bit on the strategy is to provide access to information and services to prevent early childbearing and also to prevent pregnancies. Remember, teenage pregnancies is one of the menaces that actually promotes dropout rates for both boys and girls. And to keep safe, it's good you provide information to the boys and girls so that they can make informed decision. And in cases where abstinence is not possible, then the children can be taught about protection and use of methods such as condom. The third theme looks into child rights and responsibilities. So we need to know that the children are one of the most vulnerable members of our society, mainly because of their age and also their stage of growth. They are the least when it comes to capabilities and even protective skills. So we are told that children have four pillar of children's rights, and that is the children's rights are made more of survival rights, that is the right to live or right to life. Then we have the developmental rights, there's protection right, and the participation rights. So these are rights that each and every child deserves to be provided for, and that is survival, development, protection, and participation rights. But now, how do we meet the rights of the children? So the strategy for ensuring that the policy is able to meet the rights of the children is to provide a conducive environment where each and every child in school can enjoy the given rights above. So we ensure the environment is friendly enough, the leadership is good, the environment is safe, the infrastructures are well balanced, there's good aeration, safe from breakdowns, and so on. Now, with a good environment, then we can say the children are given enough space to enjoy their rights, be it development, protection, or even participatory rights. So every child has an equal access to these rights. And we're told you're supposed to provide access to these rights without discrimination or favorism. The fourth part or the fourth theme in the policy is water, sanitation, and hygiene, commonly known as WASH. So with the WASH, we are looking at the hygiene state of the school, and we're talking about a hygienic school environment is actually supposed to be safe, to have adequate water supply, to have adequate sanitation and appropriate hygiene promotion, for it to say that the school is healthy in regards to water, sanitation, and hygiene. And this component actually looks into issues of concern such as menstrual health, hygiene, safe water, food safety, and also vermin and vector control. So the policy looked into this aspect and was considering to ensure that each school, therefore, should ensure that they have proper menstrual health services such as proper disposal of waste of menstrual materials. They're supposed to have safe water supply that is also constant, and to ensure that there's food safety and handling and preparations. Then the other bit was environmental sanitation, where the school environment is expected to be free from vermins and vectors. And these are potential risks that can cause infection in children if not properly taken care of. And on the side of strategies of ensuring there's enough water sanitations, is that the policy provided for that each school should have adequate safe water points, and this includes either boreholes or agency supplied water from the government agencies. Schools are expected to have hand washing facilities, including the supply of soaps that children can engage in the sanitary activities and they can find water to clean up with presence of soap. And the third bit of the strategy was to provide solid and liquid waste management in schools and to have proper food safety and handling for the school. Other parts of the strategy for water and sanitation was ensuring that the sanitation facilities are well designed and constructed to be gender sensitive, ensuring that it has met all the different age groups in the schools, and it is also inclusive of learners who have special needs. Schools were expected to avail menstrual health products in school. Like in the Kenyan policy, it's now said children in the lower primary schools, in the primary and secondary sections, are supposed to be provided with free sanitary towels for the ladies who have started undergoing menstruation. And the last bit was to be aware of any myths and stereotypes or taboos that are being associated with menstruation. So, like you can see, each thematic area in the policy was looking at the circumstances that are surrounding the school environment at that particular moment and the different strategies that can be put in place to ensure that that theme is well handled. So with sanitation, there's the water points, washing facilities, liquid waste management, food safety, sanitation facilities, menstrual health products, and the stigmatization of the myths and stereotypes against menstruations. So this, as you can see, is something tangible that is also very doable in the various setup in our institutions. Fifth theme is nutrition. And with nutrition refers to provision of food and nutrients to human body for the purpose of growth and development, and maintenance of life. So good nutrition, we know, increases the child attention span, it increases the child learning capacity and also ability to fully engage in their educational experiences. Hence, the child is able to reach their full potential in life. So balanced diet or food diversity promotes good concentration in class. And so children are able to fully participate in their learning activities and children are able to perform optimally because they have well balanced with all the necessary nutrients in their body. And so with the nutrition theme, it was proposed that with the policy is that with these strategies to get proper nutrition for the children, we need to optimize school nutrition services. We need to promote healthy food environment, including introduction of kitchen gardens or school gardens and farms where schools can farm and have their own farm-grown products instead of buying from the market. There's enhancing nutrition education in schools such that curriculums have embraced nutrition education as part of the learning activities in the school curriculums. And the last bit is parental and community involvement in school nutrition. Say that if a child is being admitted into schools, as parent can be brought in to have an opinion in regards to the school diet or menus and to have an incorporation of their intakes in case they have a new proposal as per what can promote good dieting and nutrition for the school environment. So with nutrition, the strategies are quite diverse, spanning all the way from the parental side and community, bringing in now the internal environment like working in the farms, curriculum based and even institution services that looks into school nutrition services. Theme number 6, and that is disease prevention and control. So with diseases, it's have to appreciate that there are very many, and with the diseases, you can vary from communicable all the way to non-communicable diseases. And diseases, unfortunately, they can lead to morbidity, they can lead to disability, or even loss of life, or what we call death. So schools are supposed to, or rather they are required to ensure that they take measures to prevent diseases through health education and through also implementation of preventive, control, and regulation interventions. So in any instance where there's a risk of a disease, schools are expected to take the necessary interventions to protect the children from such diseases. So the objective of this theme under disease prevention and control is to actually enhance prevention and control of communicable and non-communicable diseases in schools by ensuring early identification and timely response. So that's the purpose of this theme. The main agenda is to prevent and control communicable and non-communicable diseases. How? By ensuring early identification and timely response. So having understood that the main focus here is communicable and non-communicable diseases, therefore, what are these diseases that are prone to exist in school setup? So under the communicable diseases, we are prone to expose, or children are prone to exposure of HIV and AIDS. There's exposure to sexual transmitted infections such as syphilis, gonorrhea, chancroid, and so on. There's also risk for tuberculosis because of the congestion and large number of population in schools, pneumonia, diarrheal diseases, hepatitis, tetanus, snake bites in cases where there are bushes and unkept sites, jiggers, rabies, viral hemorrhagic fevers, inclusive of diseases such as dengue, chikungunya, yellow fever, and even Ebola. There's also risk of parasitic infestations. There's also neglected tropical illnesses or diseases such as Kala-Azar, trachoma, and also bilharzia. So if you look at the communicable diseases, it's like the largest population there. I think because of the fact that it can be infected from one person to the other, and part of this also have very short incubation periods. And the other bit is the non-communicable diseases. This is looking at illnesses that are not transferable from one person to another. And so it can include substance use and abuse or addiction. There's oral health, eye care, and also mental health illnesses. So with this disease prevention and control, the population of illnesses is quite broad, and so therefore the strategies put in place will depend on which disease is rampant in the school at that particular time. So moving forward at the strategies. So in the strategies, this is a collaboration between Ministry of Education and Ministry of Health. And because it's a collaborative impact or a collaborative activity, there's an input from the Ministry of Health and then there's an input from the Ministry of Education. So what will these two ministries do? So number one, they shall educate children on the various risk factors and preventive measures for both communicable and non-communicable diseases. They'll also ensure availability of guidelines and standards on promotion, prevention treatment, rehabilitation of persons with mental, neurologic, and substance use disorders. The ministries also are supposed to conduct capacity building on mental health. They're supposed to promote oral health among learners and support eye health. And the ministry also ensures all learners participate in physical activities. The ministry ensures routine screening and scheduled immunization. So if you look at this, they are collaborative. Like for the Ministry of Education, they will work on the area of educating children on the various risk factors. While on the other side, the Ministry of Health will ensure availability of guidelines and standards when it comes to prevention and treatments. But also there's common strategies like conducting capacity building, promotion of oral health, ensuring participation of learners in the physical activities, and the Ministry of Health comes in now during routine screening and immunizations. So these strategies are collaborative, but the main ministries in place here is Ministry of Health and the Ministry of Education. Seventh theme is the special needs, disability, and rehabilitation. Evidence is saying that in Kenya it is estimated that 10% of the population are made of persons with disability and 64% of this population is made of school-going children or school-going age. So the key issues under the special needs, disability and rehabilitation is that learners with special needs and disability are out of schools, they are quite vulnerable and so are at risk of not achieving their potential. It's unfortunate that caregivers and guidance are not taking their children to school, mainly because they have a disability. It's also being told that most schools lack disability-friendly environment and so it's not accommodative enough to take care of the children with disabilities. And so there's a high dropout rates of learners with special needs and disability. And this is because apart from the aspect that the schools are not disability friendly, there's high rate of stigmatization, there's high rate of discrimination. Most schools have inappropriate curriculum. Then schools have poorly equipped institutions for learning and there's insufficiently trained personnel dealing with children with disability. So it becomes an issue that maybe could be a parent who would like to take their children to school, but now they remember most of these schools are not equipped enough. Beautiful is that the country is embracing whereby at least each county could have a special needs school or a school that caters for persons with disability. But it's unfortunate that some people or some families are yet able to access these facilities. Number one, because they are very far, and number two, are not equipped enough to take in large number of children. So that's the unfortunate side. So the strategies in place to ensure that the special needs disability and rehabilitation theme is well met is that the policy ensures all learners with disability are registered with the National Council of Persons with Disability so that can enable them to access available benefits and also privileges. And the other bit is the policy promotes opportunities for youth with disability both in primary and secondary school, such as easy access of admission forms, bursaries, and even examination access. And the other bit is that it trains, motivates, and trains specialist educators in the special education sector. Although the number for the special education sector is still low, but there's an encouragement that teachers specialize more on the special needs and the population that needs rehabilitation. So in this case, number 4 of the strategy is that there is need to incorporate special needs education in the regular teacher training curriculum, that even if someone has to specialize as a special needs teacher, it is important that the regular curriculum of the regular teachers are introduced to the special needs children so that they understand how to handle them in case they get one in their class. Other bit is to design, develop, and provide appropriate technologies, assistive devices, and learning materials for learners with special needs and disabilities. And number 6, the policy emphasizes on enforcing screening of all learners on admission so that there could be early identification, assessment, placement, and referral. That also they can be organized for timely review of the appropriate interventions. So as you can see, these strategies are quite broad. There are many. Starts all the way from the ministry, goes all the way to the training institutions, and goes all the way to the learning environment. But now, remember, all this comes in with multidisciplinary approaches, from the treasury allocating funding to the curriculum being reviewed to teachers themselves coming into the classroom and be taught on the special needs education and now practicing it on the ground with the children. So it's a chain of interaction and not just a one-off activity of strategies. And the last theme is school infrastructure and environmental health safeguards. So with the school infrastructure theme, it's being said that the school environment should be very safe, serene, and conducive for learning. And so with the purpose of having environmental safety measures, it's being said that all infrastructures in the school should adhere to the stipulated regulation by the Ministry of Public Works, the Ministry of Health, and the Ministry of Education. So any building that is being brought forward or is being put in place by the school should review what is being stipulated by the Ministry of Public Health, Ministry of Health, and Ministry of Education. And these are not very complicated guidelines. Some of them is just including the number of doors that a classroom should have, the state of windows that should be installed, the lighting nature, the spacing, and all that. These are things that are included in the Ministry of Public Works. So part of the strategies of ensuring that the school infrastructures and environment is safe enough for children is to ensure that schools' infrastructures comply with building and construction guidelines. The schools are ensuring that they have safe playing grounds. The other bit is adhering to environmental safety. There's also need for provision of firefighting equipment and training for the staff and the school management. And there's also enhancing transport safety. So the safety in terms of infrastructure is widespread from the environment all the way to the buildings and even the what you call danger of disaster management like fires and so on. So with the inputs of infrastructure, there's need to just check the regulations from the different ministry highlighted here and then put these strategies in place for your particular schools and what is needed. And so thank you so much for being with me to the end. Kindly remember to subscribe, comment, share, and also like this video. If this is the content you like, subscribe and keep it all the way to the end, or see you in our next classroom. Bye bye.